From singer Tamar Braxton to the Real Housewives and even the cast of Married to Medicine, lately we are seeing more reality stars and celebrities use their platforms to advocate for HIV awareness and prevention methods like PrEP. Today is National Youth HIV/AIDS Awareness Day, and to mark the day, News 4's Jummy Olabanaji is sitting down with a panel of local experts for an in-depth discussion on the advancements, the treatment, policy research, and prevention.
So, Dr. Shaw, I want to start with you. Can you just kind of talk to us about not just the local outlook, but also national outlook when we talk about the state of HIV and AIDS in 2026?
So in 2026, HIV is still very much an issue. However, the good news is that in 2023, we had about 39,000 cases, which is a 17% decline in the last decade. 22% of people who were newly diagnosed with HIV were through heterosexual transmission. 1 in 5 people that were newly diagnosed were actually women. And amongst that, more than 56% of people were actually African-American women. DC, it has one of the highest rates of HIV. Most of the cases, the newly diagnosed cases, more than 51% occur in the southern United States. So this is very much a ground reality here in DC.
What is your number one piece of advice?
I think what we need to know is that HIV does not discriminate. It can affect everyone.
I want to next move to both Harold and Malachi. You both have been living with the virus for years. Can you talk to us just about your diagnoses and also, how you're managing your health day to day?
So last year marked 20 years of living with the virus successfully and living well because of the medications that we have today. Today, someone diagnosed with HIV who gets into medical care and takes their medication consistently can live a long, healthy life.
I was diagnosed at 20 in 2008. And so I was a young person diagnosed with HIV. And at that time, it felt hopeless. So I take care of myself by taking my medication, by remaining undetectable, which means I can't transmit HIV to my partner. People today have options that I didn't have. PrEP wasn't a thing, which is a pre-exposure prophylaxis. That wasn't something that you could take to prevent HIV.
And I'm glad you brought up PrEP. And Dr. Shah, I want to get to you because some people might not know what PrEP is, what it stands for, what it does.
Prevention or HIV PrEP is actually medication that people can take if they're HIV negative to help protect them and decrease their risk by about 99%. The HIV Prevention Toolkit or HIV PrEP contains medications that have been available since 2012, which are daily oral pills like Truvada, and we now have injectable options as well.
Just recently, a bunch of Bravo stars from Housewives to Married to Medicine have been not just here in DC on Capitol Hill, but also on, TV as well in interviews. And they're talking about PrEP, prevention, HIV funding.
And that's why I'm a big advocate of PrEP. PrEP is not just for men who have sex with men. It is really for anybody who is sexually active.
It's kind of been in the headlines lately. So Malachi, what do you think?
It's so important because it can help people see and normalize the conversation. That is the greatest way to fight stigma.
I'm happy to have the Housewives talking about HIV on Capitol Hill, bringing the conversation forward so that individuals can feel normal going into a doctor's office and talking about HIV, asking for an HIV test.
In the last year, we've also seen some cuts coming from Capitol Hill and the White House and the administration to some of that federal funding. First, Harold, I want to ask you, what is, your organization doing to help?
So our organization, the National Minority AIDS Council, has been doing a lot of work both on Capitol Hill, working with lawmakers, but also working with the community to get them to use their voices to make sure that lawmakers understand the impact of some of these cuts, both cuts in HIV prevention and what that means, as well as cuts in medication access.
National Youth HIV and AIDS Awareness Day. For each of you, what is your hope?
It's an opportunity for young people to get information about both protecting themselves and information about the virus, how to get into medical care.
What I hope is that with the expansion of the HIV Prevention Toolkit, we can reach more people.
As a person who was diagnosed as a youth with HIV, my hope is that we are continuing to provide the care and support that if a young person does get that diagnosis, that they feel like that they are not defined by it, that they feel like that there is still hope. I don't want any young person to feel how I felt. I want them to see people like me, people like Dr. Harold living and thriving with HIV and knowing that there's a possibility to go on.